Good morning and welcome to the Senate Committee on Education and Health. Clerk, would you please call the roll? This is the best way to get everybody in their chairs.
Madam Chair, you have a quorum.
Thank you, Mr. Clerk. Okay, today we have 81 bills on the docket, so we're not going to be fooling around in here today. I'm going to start by reminding everybody how we will operate. First, I think the first thing we're going to do is begin with Senator Stewart's Senate Bill 1023. I think there's a motion on that.
Madam Chair,
Yes.
I spoke with Senator Stewart yesterday, and he asked that we strike the bill.
He moved to strike, he wants to strike the bill. Okay, you hear the motion? To strike Senate Bill 1023? All in favor of that motion, please say, I think we need to vote electronically. Please designate your preference on the electronic voting board.
Ayes 11, no 0.
Ayes 11, no 0, the bill is stricken at the patrons' request. Next, each of the subcommittee chairs will give a report. Members, on your desk, there are packets containing the substitutes and amendments adopted by each subcommittee. Every bill that went through the subcommittee had the opportunity for public testimony, and we will not hear additional public testimony. We will only hear from patrons on these bills if it is absolutely necessary. Is that clear? Okay, we're gonna start with health professions. What's Senator Barker's not in his chair? Okay, well, we don't have time to wait. Where is, well, that's all right. Okay, we'll wait until he gets here. So we're gonna go on with the bills from the health chair, and that's Senator Peterson.
Thank you, Madam Chair. Our Health Committee met the other, I guess it was, would have been Tuesday evening, and we had a great discussion, took up a lot of bills, heard from a lot of great witnesses, and here are the results. I'm going to take these in numeric order, starting at the bottom. Senate Bill 791 was patroned by Senator Chase. It had to do with effectively an act that would have put limits on gender transition medical procedures under the age of 18, as defined in the bill. It was the opinion of the subcommittee that these were decisions best left to parents and their children. These were all minors. And based upon that, it was our recommendation to PBI the bill on a vote of 4-0. And I so move. And before we make that bill also incorporated Senate Bill 1203 from Senator Reeves, which was similar, if not identical. So I would make a motion to consolidate those two bills first.
You heard the motion to consolidate? All in favor?
Aye.
Aye.
And then having...
Oh, let's
It's
record that
recorded.
vote.
Okay, this is a motion to consolidate the two bills, 791 and 1203.
You've heard the motion to consolidate. All in favor of that motion, please designate electronically.
Incorporate.
Yeah, this is to incorporate.
Okay.
Ayes 12, no 0.
Ayes 12, no 0. Senator Peterson.
And having incorporated the two bills, I would now move to pass by indefinitely for the reasons stated earlier.
The motion is to pass by indefinitely with a second. All in favor of that motion, please designate electronically.
Ayes 8, noes 5.
Ayes 8, noes 5. The bill will be passed by indefinitely. Senator Peterson.
Next bill, Senate Bill 792, also for Senator Chase, prohibited discrimination based on COVID-19 immunization. We had a very robust discussion on this bill. I think the concern was it really gets into private employer-employee decisions, whether or not employers require COVID-19 immunization for certain healthcare providers or for whatever reason they feel is necessary. And so we decided it was not appropriate to add this to the state code, and we voted on a 4-1 vote to pass by, and I so move.
You've heard the motion and the second that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 8, noes 5.
Ayes 8, noes 5. The bill is passed by indefinitely. Senator Peterson.
Next bill, Senate Bill 827. This was Senator Favola's bill, had to do with hospital emergency departments, required security training, had to do with basically violent incidents that happened in ER departments, and set up protocols to make sure that there are ways to deal with and de-escalate those situations involving law enforcement and trained security officers. And we reviewed this bill and reported it unanimously 5-0, and I so move.
You've heard the motion? And the second? All in favor of that motion, please designate electronically.
Ayes 13, no zero.
Ayes 13, no zero. Bill will be reported with the substitute.
Okay. Next was Senate Bill 833, and I should have rolled this into 792, but I think we can just take it up separately. It was identical to 792. And again, this is the COVID-19 discrimination bill. And what I'd do at this point is just, since we've already PBI'd the earlier, I'd motion to pass this bill also by indefinitely.
It's been moved and properly seconded that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
It's the same bill. We've already PBI'd it. What? Well, but we don't have to. Just PBI it. It doesn't matter.
Yes, it was.
One less vote. I'm trying to save energy here. Okay. Suderline, stop causing problems.
Mr. Clerk, could you please report the vote?
Ayes 8, noes 4.
Ayes 8, noes 4. The bill will be passed by indefinitely, Senator Suderline.
All right. Thank you, Madam Chair. If I could move on to Senate Bill 953.
Please do, sir.
This was my bill, which I think the committee, after having heard it, has decided is the bill of the session and really needs to be celebrated as such. It has to do with the expedited review of certain COPN requests. It's both diagnostics, outpatient surgeries, which have and also added an additional psychiatric bed. So it's defined categories of what are high demand medical processes, which basically we give them expedited review under the COPN process. It's not the COPN repeal bill, which is still not out there, but this is just basically a limited way to make our medical health care more efficient. So it was the decision of the subcommittee to report this 3-2, and I so move.
It's been moved and properly seconded that the bill be reported. All in favor of reporting?
I believe it needs to go to finance.
Oh,
Senator
requested by
Peterson, could you-
finance.
Senator Peterson?
The
bill will
dark
be
prince over here has to speak.
Madam Chair, first of all, it does need to go to finance. And secondly, this is, I'll offer a substitute motion to pass by indefinitely. This would be a very significant change and would put at risk a lot of the financial situations as it relates to a lot of the hospitals.
Okay, there's a substitute motion, and that is to pass by indefinitely, and has been seconded by the chair of finance, and so it had been said, so it shall be done.
Can I
All
speak
in-
to that before?
Senator Peterson, you may speak to that, but I think it's on its way to finance.
Well, it's going to go to finance, but let me just make a point here that this is a motion to PBI. This is an important bill.
That's right, you don't want to.
We have struggled with the COPN system since I've been here, and that's 22 years. And this is a very limited, targeted way to just have a more efficient review. More efficient review. And perhaps even that's too much for the establishment. We'll see. Please pass this bill and send it to finance. Thanks.
The substitute motion? That was a substitute motion from Senator Barker. Senator Barker made the substitute motion to pass the bill by indefinitely. Okay, turn up your microphone on your A's there. You're right, and sometimes it doesn't work, does it? You've heard the substitute motion, and that is to pass the bill by indefinitely. All in favor of that motion, please designate electronically.
Ayes 8, noes 7.
Ayes 8, no 7, the bill will be passed by indefinitely. Senator Peterson, back to you.
Okay. I'm recovering from that, okay. Next is Senate Bill 960, which is patroned by Senator Peake. This also had to do with gender transition procedures. It was a little bit broader than Senator Chase's bill, which simply dealt with procedures for those folks under 8, or those children under 18. Basically, this was a broader bill in terms of gender transition. We felt it was too broad, and again,
Mine was less broad. Mine didn't include hormones or anything, it was just surgery.
He's going to
Okay,
tell you what the subcommittee thought about
yeah,
it.
well,
Senator Peterson.
I respect Senator Peake is not going to agree with my motion, but it was unanimous by the subcommittee 5-0. Okay, all right. We voted 5-0 to PBI.
You've heard the motion, and it was 5-0 to PBI. So all in favor of that motion, please designate it electronically.
Ayes 10, noes 5.
Ayes 10, noes 5. Senator Peake, your bill will be passed by indefinitely. Senator Peterson.
Thank you, Madam Chair. Senate Bill 972 was another Peake bill, but this one we passed unanimously. This had to do with the power of the state health commissioner and just recognizing that there was a religious exemption as well as what was already in the code for required immunizations. This specifically had to do with COVID-19. I believe this consisted with the First Amendment, but the bottom line is we pass this on a 4-0 vote, and I so move.
You've heard the motion?
Madam Chair.
Senator Hashmi.
Madam Chair, I just asked the committee chair to expand a little bit. I have concerns on, particularly on lines 80, 81, where in the code it says the parent or guardian has the child, has the right to not immunize the child if it conflicts with religious tenets or practices unless an emergency or an epidemic disease has been declared by the Board of Health. I think we are doing a disservice to our critical need for public health protections if we strike that language from this particular bill. And I would just ask clarification about the discussion around that issue.
Senator Peterson.
Well, I will simply say we had a subcommittee hearing on this bill. Nobody spoke against it. And typically, as I understand under First Amendment, if a child or if a parent objects to an immunization, if there's a defined religious basis, there's a definite religious basis typically under the First Amendment, that's not a means to deny that child's schooling or anything like that. And so again, nobody testified against it in the subcommittee, which, you know, the way this body works, if we don't get opposition and we have people in favor of it, typically we'll move it forward.
Substitute motion, Madam Chair.
Senator Hashmi.
Madam Chair, for the issues around public health and the emergency and the crises that we sometimes face, I would prefer that we not put this kind of restriction around our Board of Health. I would move that we pass by indefinitely.
There's a substitute motion to pass by indefinitely. All of Senator Saslaw. Senator Saslaw, do you want to speak?
They have just to say that, I don't know about, you mentioned the First Amendment, but the California law has been upheld, which has no exceptions whatsoever, even if you go to a private school. No exceptions.
There's a motion on the floor.
Well, I'll speak to it.
Senator,
And I realize we may have a
Peterson.
division in this committee, and I know some people think we ought to follow California when it comes to public health. I beg to differ. I think there are times where people have legitimate religious reasons to not accept an immunization, and that's not a reason to deny them public health benefits or public schooling. And I guess we'll find out. But again, medicals aside, nobody spoke against this bill in subcommittee, and I realize some people don't like religious exemptions, but we do have a First Amendment in this country. Thank you.
there is a motion on the floor, and the motion is to pass by indefinitely. There was a motion and a second. All in favor of that motion, please designate electronically.
Ayes 8, no 7.
Ayes 8, no 7. The bill will be passed by indefinitely. Senator Peterson.
Yes. Taking me to Senate Bill 1132, Criminal Record History Dissemination. Allows criminal history record dissemination to be disseminated by the Commissioner of Behavioral Health. And basically, it was for people that are being evaluated for their sanity at the time of a criminal offense. I don't remember a lot about this hearing, to be honest, Madam Chair. We did pass it on a 4-0 vote, and I so move.
You've heard the motion? And a second by the patron. That the bill be reported with a substitute. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported with a substitute. Senator Peterson.
Yes, ma'am. Senate Bill 1155 had to, again, with the Department of Behavioral Health, DBHDS, had to do with provider licensing and allows them to make an unannounced inspection during the licensing period. Right now, it's an annual unannounced inspection, and this basically just gives them a little bit more leeway to check up on their, I assume, their group homes and other services. So we heard this bill and recommended it on a 5-0 vote.
You've heard the motion? And a second. That the bill be reported with a substitute. All in favor, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported with a substitute. Senator Peterson.
Yes, Senate Bill 1169, Community Service Boards. Basically, I think it just says what it says. This was a fairly complicated bill that basically reorganizes its provisions and around Department of DBHDS and Community Services Boards. I'll be blunt, it was all very technical, and I didn't really understand what they were saying, but nobody objected, and it passed on a 5-0 vote, so I so move.
It's been moved and properly second that the bill be reported with a substitute, even though none of the committee members understood.
Right.
So all in favor of that motion, please.
Ayes 13, no 0, 2 abstentions.
Ayes 13, no 0, 2 abstentions. The bill will be reported with a substitute. Senator Peterson.
Thank you, Madam Chair. This bill this is Senate Bill 1170 from Senator Hanger and gives the Behavioral Health Commission the ability to access records, basically of certain entities that are doing business in the Commonwealth. I think there was a little bit of unreadiness on this bill. It also says the records will be exempt from FOIA, which gives some comfort. I think a lot of people were kind of wondering exactly what the Behavioral Health Commission needed these records for. I see Senator Hanger here, and there were some abstentions. So, Madam Chair, I know you don't like testimony, but maybe it would be helpful to just get a sentence or two on what exactly we're doing.
We did say it's necessary, and he said a sentence and two, so that means 1 minute.
1 minute. I'm not going to talk that long, Madam Chair. Thank you. That previous bill, the 3 bills in front of you, in front of Senator Peterson's subcommittee, were recommendations of the Behavioral Health Commission. This specific, the 2 of them, JLARC recommendations. This one from the commission will give basic authority for doing research for the studies that we need within the commission. It's patterned after JLARC authorities, but it's watered down significantly. The sheriffs had some concern initially. We took that part out. They're happy now. And it will, I think, be necessary for the commission to do its work. We're communicating with the House. There's a House tracking, and they liked our bill so much they patterned their bill after ours yesterday. I know we're not supposed to talk about them, but this is a good bill, Madam Chair. Thank you.
Thank you. Patron of the bill says this is a good bill.
Okay,
Senator Peterson, what does the committee think?
we did recommend reporting on a 3-0-2 vote, so I so move.
It's been moved and properly second that Senate Bill 1170 be reported with the substitute. All in favor of that motion, please say aye. Senator Saslaw, would you also vote too?
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported with the substitute. Senator Peterson?
Yes, ma'am. Senate Bill 1203 was incorporated to 791, so we've already dealt with that. Senate Bill 1297 had to do with in-person visitation policies. This was Senator DeSteff's bill, and it had to do with visiting our older citizens and constituents and friends and parents in nursing homes. I think it was a very well-intentioned bill, but there's already pretty clear federal law on point, and it would have been confusing to providers to try and comply with this and comply with federal law. And as a result, we voted 5-0 to PBI, and so I so move.
It's been moved and properly second that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 13, noes 1, 1 abstention.
Ayes 13, noes 1, 1 abstention. The bill will be passed by indefinitely. Senator Peterson?
Senate Bill 1315 was kind of the opposite of what we did last year, which is gave people freedom of choice on masking, and this would have basically said you can't have masking at all in private employers and colleges, and would have created a private cause of action. I think it was a little bit further than we were willing to go, even for me, and you know where I stand on this. So we voted 5-0 to PBI, and I so move.
Madam Chair.
Senator Lang?
Thank you very much, Madam Chair. I was part of the 5-0 vote to PBI. Something just briefly, this bill, the summary doesn't let's completely do it justice, although it does mention that even private schools would be prohibited.
Right.
Last year, Senators Peterson and Donovan led an important effort, I think, to restore parental choice. And you're choosing to send your child to a private school, and this would not even allow the private school to do this, where the parents already made this decision to send them there. And also, the employer provision would even prevent hospitals and other medical facilities. Yeah, there would even be prohibitions on them having masks. You know, those of us that have been in a surgical room for a loved one's procedure or anything long before COVID, we understand masks are worn there, and this would prohibit that requirement. You know, I would hope all our doctors and nurses would agree to do it, but this is just not a very well-crafted bill.
Right.
It's been through the
5-0
subcommittee.
PBI, right.
And it does have a motion and a second, and that is to pass by indefinitely. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be passed by indefinitely. Senator Peterson?
Okay, Senate Bill 1327 is an important bill. It had to do with healthcare coverage for DMAS for young folks that are under the age of 19. In other words, they're minors, are not covered by group health plan or health insurance, and are basically in DACA status, and would allow them to access DMAS benefits. There's obviously a financial impact on this. We heard a lot of great testimony from folks about how spending money for these young people, and the healthcare coverage for young people is a lot less expensive than it is for old people like me. Now, the bottom line is we voted 4-1 to report this bill and send it to Finance, and I so move.
It's been moved and second that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 11, noes 4.
Ayes 11, noes 4. The bill will be reported and re-referred to Senate Finance. Senator Peterson, you had a lot of bills.
Yes, ma'am. Senate Bill 1339, Senator Barker, minimum staffing standards for certified nursing facilities. Very controversial bill. You know, we had to shout down the opposition, and yet it still passed 5-0. And despite Barker stabbing me on the back in COPN, I will move to report this bill. And it was 5-0. I move to report. All right, and re-refer to Finance.
You've heard the motion and the second that Senate Bill 1339 be reported and re-referred to Senate Finance with a substitute. All in favor of that motion, please designate yea, nay, or abstention.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported and re-referred to Senate Finance with a substitute. Senator Peterson.
Senate Bill 1416, Senator Pillion asked to strike that, and I so move.
It's been moved and properly second that the bill be stricken. All in favor of that motion, vote electronically.
Ayes 14, noes 1.
Ayes 14, noes 1. The bill will be stricken at the patron's request.
Yes, ma'am. Senate Bill 1432 was Senator Hashmi's bill on health records privacy, and had certain requirements about keeping health records private. And she requested that we pass the bill by indefinitely with a letter to the Joint Commission on Health Care, and I so move.
It's been moved and properly second that the bill be passed by indefinitely with a letter at the request of the patron. All in favor, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be passed by indefinitely with a letter at the request of the patron. Senator Peterson.
Thank you, Madam Chair. Senate Bill 1452 from Senator Newman had to do with the COPN exemption for a nursing home facility in Amherst County, which I think is from the training center, and just basically directs the state health commissioner to accept and review applications for essentially reutilizing that space. And so we reported it with amendments. Do we need to report the amendments? I move that we accept the amendments.
It's been moved and properly second that the amendments be adopted. All in favor, please vote electronically. We need an electronic vote.
You
Okay.
just adopt.
Okay, voice vote. All in favor, please say aye.
Aye. And then,
Senator Peterson.
having amended it, I would move that we pass, report the bill.
It's been moved and properly second that the bill be reported with amendment. All in favor, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the amendment. Senator Peterson.
Yes, ma'am. Senate Bill 1465 was another of the Emmett Hanger bills on Community Service Board, Senator Hanger bills. This one, again, very technical, sort of moving around some of the definitions and responsibility of CSBs and behavioral health authorities. You know, he just wore us down, so.
Mr. Chairman, Madam Chairman, I can speak to the bill.
Okay.
Madam Chairman, these
Senator
two,
Donovan.
thank you. The two bills, and I'm not sure which one this is, basically defined and required a contract between the CSBs and the state with measurable metrics of accountability. In the past, it had been may have these kinds of accountability metrics with CSBs, and these direct that we will have those accountability measures, and that the department will set, the DBHGS will set up clear metrics so that the CSBs know what to do, and the CSBs in turn will have to meet those performance metrics. And so those are what the two bills do.
Thank you. Senator Peterson.
Yeah, I move that we report the bill. That was the recommendation was 5-0.
It's been moved and properly second that the bill be reported with a substitute. All in favor, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute.
Okay, Senate Bill 1474 is the food truck bill. Directs the Department of Health to basically amend regulations and guiding documents relating to mobile food units that they can produce the food within a 50-foot radius of the mobile food unit. Right now, they can either cook it in the kitchen or cook it in the mobile food unit. And this has to do with, say, grills or things that they set up and then go ahead and put it in the food truck. We didn't have any opposition. I think I've heard a little unreadiness since then, but I will say the subcommittee heard the bill 5-0 and moved to report, and I so move.
It's been moved and second that the bill be reported. All in favor of Senate Bill 1474 being reported, please designate your preference electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported. Senator Peterson.
Yeah, the next bill, 1475, was more contested, and we took an opposite resolution. Basically, this bill says that if the initial permit is issued for a food establishment, that the locality is bound by that determination, and they can't then go back and revoke the permit, even if, frankly, the regulator or initial examiner was negligent or corrupt or what have you.
Corrupt.
I felt like, well, I'm sure that never happens, but I felt like it was a little bit much. And so we voted on a 3-2 vote to pass the bill by indefinitely, and I so move.
It's been moved and second that the bill be passed by indefinitely, and I see a lot of concerned faces up here, but you have an opportunity now to designate your preference electronically. Please do so.
Ayes 10, noes 5.
Ayes 10, noes 5. The bill will be passed by indefinitely. Senator Peterson.
Okay, the next bill was Senate Bill 1487. And it's the alkaline hydrolysis bill, which is apparently a method of treating dead bodies. There may or may not be an environmental effect from that. It basically allowed a registration requirement that would bring in DEQ to kind of take a look at this. This was something that was supported by the funeral home industry. We had an interesting group of folks that were not fans, namely the Catholic Conference. And I can't remember who else testified against it. It was a little bit of a strange bill, and I don't know how else to define it, but we did vote on a 302 to report the bill and send that to you all with a recommendation to report. Oh, I'm sorry, there's an amendment, yes.
There's a motion on the amendment and a second. All in favor of adopting the amendment, please say aye.
Aye.
Madam Chairman,
Senator Donovan?
I was one of the concerns on this bill because I had received information from a constituent about the potential challenges of processing the waste in our wastewater system. And I believe that the amendment speaks to involving the wastewater
Right.
companies or providers in each area in the approval process so that they can verify it can manage this effluence, as they call it. So I think that the amendment corrects the challenges and move to support the bill.
We've already adopted the amendment. The
Right.
motion on the bill is the report.
Right.
With the amendment. All in favor of that motion, designate electronically.
Okay.
Ayes 13, noes 2.
Ayes 13, noes 2. The bill will be reported with amendment, even though I don't know how you treat a dead body. Senator Peterson?
I'm just glad we didn't get any abstains on that one. Okay. Senate Bill 512 had to do with temporary detention orders, or TDOs, as we like to call them, and simply authorizes hospitals with a psychiatric department to employ individuals that can make a TDO determination. This had some of the criteria that would be used, and then basically just walks it through what that process would look like. This bill has an expiration date of July 1, 2025. I see we have someone here to testify. It came out on a substitute, so let's adopt the substitute first.
The substitute's been moved and second. All in favor, please say aye. Aye. Senator Peterson?
And then it reported 5-0, so I don't know if we need any further testimony on this.
It's had all the testimony we need, and it came out with a 5-0. So we're gonna move with the amendment. We have a bunch of bills in here. We need to move quickly. Senator Peterson?
Okay, I move that we report the bill, report the substitute.
It's been moved and seconded that the bill be reported with the substitute. All in favor, please say aye.
Aye.
Ayes 14, no 0, 1 abstention.
Ayes 14, no 0, 1 abstention. The bill be reported with the substitute. Senator Peterson?
Last thing, or a couple more things. Senate Bill 1526 is a COPN for cardiology services, and that was stricken per the patron request, and I so move.
It's been moved and properly seconded that the bill be stricken at the patient's request. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be stricken at the patient's request. Senator Peterson, you have 2 more bills?
Yeah, Senate Bill 1538 came from Senator Pillion. It has to do with pharmacy technicians and allows DMAS to reimburse their services. I think this was just an oversight in the code, and so that's what this bill does, and it doesn't appear to have a financial impact, and it was reported 4-0 as a substitute, so I would move the substitute. Move we adopt the substitute.
It's been moved and properly seconded that the substitute be adopted. All in favor of that motion, say aye.
Aye.
Senator Peterson?
And then, having adopted the substitute, I move we report the bill.
It's been moved properly seconded that the bill be reported with the substitute. All in favor, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported with the substitute. Senator Peterson, you have one last bill?
Yeah, the last one was a bill from Senator Eben. I think it had to do with the City of Alexandria situation. It just exempts from VDAX inspection a food establishment that's a restaurant, has a restaurant license from the State Department of Health and is supplying food to a school or a daycare center. And like I said, has a restaurant license from the Department of Health, and there was no opposition to this, and we reported a substitute. So I move we adopt the
The
substitute.
substitute's been moved and second. All in favor of that motion, please say aye. Aye. Senator Peterson.
And having adopted the substitute, I move we report the bill.
It's been moved and properly seconded that the bill be reported with the substitute. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute. And Senator Peterson, I thank you.
Thank you. We covered a
so
lot of
much.
ground. Thanks.
Thank you so much. And now, I've already told everybody that this is our last meeting before we cross over, and that the subcommittee will not meet again until after crossover. So we're going to try to plow through these bills so that we can get out of here in time for session. And now we're going to circle back to Senator Barker, who will give us the report from the health professions. Senator Barker?
Yes, Madam Chair. We had the Health Professions Subcommittee, which has 9 of the 15 of us participating in that. We had 14 bills before us last Friday, and we apparently were in a good mood because we approved 12 of them, and only one of them got more than one negative vote. So, and one of the 2 that did not pass was stricken. So anyway, we're going to start out with Senate Bill 932, patron of Senator Hashby. This deals with establishing a Virginia psilocybin advisory board and have that board deal with the issues related to the Drug Control Act and reclassification of the psilocybin, which is a drug, and have that report done this year. And we reported that out on a 6-1 vote, and I so move.
You've heard the motion? Senator Donovan? Senator Howell?
Does not, okay.
No. You've heard the motion and the second that the bill be reported. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported.
All right.
Senator Barker?
Yeah, next is Senate Bill 1054, Senator Peak as the patron. And this deals with interjurisdictional compacts and criminal history record checks. So if individuals don't have to go running around every jurisdiction to have their criminal history separately checked by the different jurisdictions. This was reported 9-0, and I so move.
You've heard the motion? And a second that the bill be reported. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported. Senator Barker?
Then the next one is Senate Bill 1070, the patron is Senator Newman. This deals with parental access to minors' medical records. It would override what has been the practice and the code in terms of allowing certain minors to be able to receive services without their parents automatically being informed. And this bill was passed by indefinitely on a vote of 6-3, and I move that we pass the bill by indefinitely.
It's been moved. And second. That the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 10, noes 5.
Ayes 10, noes 5. The bill will be passed by indefinitely. Senator Barker?
All right, Senate Bill 1090 is from Senator Eben, deals with the Board of Pharmacy and a permit to operate a pharmaceutical processor or cannabis dispensing facility. Would deal with the situations that we have in each health service area and increases the limit of the number of facilities that can be operating with this in different geographic areas. This one was reported on a vote of 5-3 with 1 abstention, and I move that we report the bill.
You've heard the motion and the second that the bill be reported. All in favor of the motion, please designate electronically.
Ayes 10, noes 2, 3 abstentions.
Ayes 10, noes 2, 3 abstentions. The bill will be reported.
All right, we have, next one is Senate Bill 1119. Senator Stewart is the patron of this. It's dealing with telemedicine.
Madam Chair,
Senator Suline.
having voted on the prevailing side by which we voted to report 1090, I'd ask that we reconsider that vote, because I keep hearing several people saying they may have wanted to vote different.
Can we finish this bill first and then, Senator Barker, complete this one and then we'll go back to?
Yeah, we asked, did he ask for?
You on Senate Bill 1119. We're going to finish the motion on this bill and then we will
Okay,
go
then we'll
back.
go back. Okay, that's fine. This deals with telemedicine. Last year, Senator Stewart had a bill to allow people who have received services out of Virginia, but who live in Virginia, to receive telemedicine services from the physician that had taken care of them. And in his area, there are a lot of people who go to Maryland, particularly to Johns Hopkins, for these services. And what this does is extends it a little bit so that if the treating physician is not available for telemedicine visit, then others in a multi-specialty group can step in and provide that service there, just as they would if you were going to go to the doctor and the doctor that had taken care of you earlier was not available, you would probably be seen by someone else in that practice. This was reported with a substitute on a vote of 9-0, and I so move to report the bill.
There's a motion? Second. And a second that the bill be reported. With the substitute, all in favor, please designate electronically.
Ayes 15, noes 0.
Ayes 15, no 0. The bill will be reported with a substitute. And momentarily, let's go back to Senate Bill 1090. Senator Suderline, you wanted a reconsideration of the vote?
Yes, ma'am.
All in favor of the vote being reconsidered, please designate electronically.
Ayes 15, noes 0.
Ayes 15, no 0. The bill will be reconsidered. Senator Suderline.
Thank you, Madam Chair. I'd move that we report Senate Bill 1090.
Second.
It's been moved and properly second that Senate Bill 1090 be reported. All in favor of that motion, please designate electronically.
John.
Ayes 11, noes 1, 3 abstentions.
Ayes 11, noes 1, 3 abstentions. The bill will be reported.
All right. Next one is 1255.
Yes.
From Senator Donovan. We've had an emergency department care coordination program that has been actually operating quite well in many respects in Virginia for several years. This bill is from Senator Donovan, and it's basically to expand the program and have it be more effective than it already is. And we did adopt a substitute and reported with that with on a 9-0 vote. So I will move that the substitute be adopted.
It's been moved and properly second that the substitute be adopted. All in favor of that motion, please say aye.
Aye.
Senator Barker?
All right, and with that, I will make the motion to report the bill.
It's been moved and properly second that the bill be reported with the substitute. All in favor, please designate electronically.
Ayes 15, noes 0.
Ayes 15, no 0. The bill will be reported with the substitute.
All right.
Senator Barker.
And the next one is Senate Bill 1275, also from Senator Donovan. This is dealing with midwifery and administration of medication, and it allows licensed midwives to obtain, possess, and administer drugs and devices within the scope of their practice. We did adopt a substitute, and then we did also reported it with a substitute on a 9-0 vote. So I will move the substitute now.
It's been moved and second that the substitute be adopted. All in favor of that motion, please say aye.
Aye.
Senator Barker?
All right, and I move now that we report it with the substitute.
It's been moved and properly second that the bill be reported with the substitute. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute. Senator Barker.
All right, next one is Senate Bill 1337, also from Senator Donovan. It deals with the medical marijuana program and the product registration, dispensing, and record keeping, and it allows pharmacists who are employed by a pharmaceutical processor or cannabis dispensing facility to issue written certificates for cannabis products under certain circumstances. And with that, I will move that we adopt the substitute.
Madam Chairman,
Senator Donovan.
Mr. Chairman, there's a new substitute that is
Okay.
just a consensus from the advocates that have been working, and mostly what it does is it allows access to your private provider when you go into the pharmacy through a teleconnection, in addition to having the medical director at the pharmacy.
Okay. All right, well, I will withdraw the motion of the committee substitute.
Move the
and
new
then-
substitute.
and then Senator Donovan, yeah. And I'll second the motion to adopt the new substitute.
You've heard the motion on the distribution of the new substitute to Senate Bill 1337.
Can we just
And second,
briefly, I think we're running a great pace, but can we just briefly look at this for a moment, since it's different than what came out of subcommittee?
I would prefer Senator Donovan would just briefly explain it to us so we don't waste a lot of time having everybody read the entire new
Mr.
substitute.
Thank you, Madam Chairman and members of the committee. And again, the substitute speaks, and I can have counsel correct me, but this is a consensus with the advocates, and the biggest change is that there was a mechanism that was created to allow, so really what this bill's intention, one of its major intentions, other than just some cleanup on process, one of the intentions was to change the process by which medical authorization was given to a patient in order to get medical cannabis products. And historically, you've had to find somebody to make an appointment with. It usually was a cash payment of a considerable amount of money. This was an expense and an obstacle to getting safer medical marijuana instead of getting illegal marijuana. And because it has been an obstacle that has, by best analysis, resulted in a decreased utilization than expected of medical marijuana in Virginia, the change was to put a medical director over the pharmacies so that a physician there would be able to authorize the patient, keep the process intact, but change the channels and the costs of patients getting that medical authorization. Because there's a large private sector, component of this right now where patients are getting authorization from a physician, usually at a televisit. A mechanism has been set up so that those patients can reach out to their provider while at the pharmacy in a televisit instead of using the medical director. And there was some debate about labeling a specific cannabinoid, and that has been left out as it was originally in the bill.
Thank you, Senator Donovan. All right, you've heard the explanation of the new substitute. Now, all in favor of the motion to adopt the new substitute as explained by Senator Donovan, please designate your preference electronically. Oh, aye. Nays have the same right, and aye sounds to me like ayes have it. So now, Senator Barker.
I now move that we report with the new substitute.
It's been moved and properly second that the bill be reported with the new substitute. All in favor, please designate electronically.
Ayes 10, noes 2, 3 abstentions.
Ayes 10, noes 2, 3 abstentions. The bill will be reported with the new substitute. Senator Barker?
Yes, the next bill is Senate Bill 1342. I'm the patron of that, the only one I had at the subcommittee. Deals with licensure of anesthesiologist assistants, which I was hoping we would get established this year, but it's not going to happen, so I move that we strike the bill.
You've heard the motion that the bill be stricken at the patron's request. All in favor of that motion? I think we need to have an electronic vote. All in favor, designate electronically.
Ayes 15, no 0.
Ayes 15, noes 0. The bill will be stricken at the request of the patron. Senator Barker.
All right, next bill is Senate Bill 1406. As patron is Senator Vogel. This deals with behavioral analysts and assistant behavioral analysts, and this establishes licensure criteria and certifying entities And then this would be done through the Board of Medicine, that certain documentation must be provided to get these people licensed. So, and we reported on a 9-0 vote, and I so move.
It's been moved and second that the bill be reported. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero, the bill will be reported. Senator Barker.
All right, next is Senate Bill 1426. The patron is Senator Suderline. This is administration of controlled substances by paramedics. It allows paramedics certified by the Board of Health to act pursuant to a prescribing practitioner's order and who are employed and engaged in a hospital to administer the controlled substances. And we adopted a substitute, and I will move that substitute now.
You've heard the motion to adopt the substitute. All in favor of that motion, say aye.
Aye.
Senator Barker.
All right, and I now move that we report the bill with the substitute.
It's been moved, and I'm waiting for, it's been moved and properly seconded that the bill be reported with the substitute. All in favor, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero, the bill will be reported with the substitute. Senator Barker.
All right, next is Senate Bill 1440. Patron is my friend Senator Locke here, and this deals with the Board of Medicine and continuing education and dealing with the issues of implicit bias and cultural competency in healthcare, which has certainly been an area of a lot of effort to be able to deal with these issues over the last several years. It requires the Board of Medicine to adopt policies that were established. And what this does is we adopted a substitute, and if I'm remembering correctly, there would have to be a curriculum that would be available but not required for the physicians. And I will move now the substitute.
You've heard the motion on the substitute?
Madam Chair.
Senator Locke.
Madam Chair, this was done in the subcommittee, and I do not consider this substitute to be a friendly substitute. Therefore, and this bill we had last year, and it was the request last year to refer this to the Task Force on Maternal Health Data and Quality Measures for them to study it. That never happened. And because the task force claimed that they never got the letter to actually study it, so they never put it on their agenda. So I do not like this substitute and therefore do not wish to accept that substitute. So therefore, I would move to strike SB 1440 and have a letter sent to the Task Force on Maternal Health Data and Quality Measures and ask that they do study it this time. And address the issue of implicit bias and cultural competency in healthcare.
You have heard the motion by the patron and a second.
Right.
All in favor of that substitute motion?
Yeah, PBI with the letter.
Yes. All in favor of the substitute motion to pass by indefinitely with a letter requesting that they do as she said this time, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. This cold is not gonna get me down. Senator Barker.
Senate Bill 1531 from Senator Donovan. It's establishing a neonatal perinatal collaborative that where we would actually establish and review a lot of things that are happening. There was amendments made to the bill, and I'll move the amendments now.
It's been moved and properly second that the amendments be agreed to. All in favor of that motion, please say aye.
Aye.
Noes have the same right. Sounds like the ayes have it. Senator Barker.
All right, and with that, we recommended reporting with the amendments on a 9-0 vote, and I move that we report with the amendments.
It's been moved and properly second that the bill be reported with the amendments. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the amendments. Senator Barker, you have one more bill?
One more bill, Senate Bill 1539 from Senator Pillion. This deals with the practice of dentistry and would allow dentists to be able to use Botox injections as part of their practice of dentistry. We did make an amendment to it, and I'll make a motion to adopt the amendment.
It's been moved and properly second that the amendments be adopted. All in favor of that motion, please say aye.
Aye.
Nays have the same right. Sounds like the ayes have it. Senator Barker?
And this is not a conflict of interest for Senator Pillion, since he's a pediatric dentist, and so he doesn't have to, he doesn't use my Botox on it.
This is a brochure bill.
So yes. I move that we report the bill with the amendment.
It's been moved and properly second that the bill be reported with the amendments. All in favor of that motion, please designate electronically. Okay.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the amendments. And Senator Barker, I thank you again for your very fine report. Next, a subcommittee report will be given by Senator Hashmi, and that's the Subcommittee on Public Education.
Thank you, Madam Chair. The first bill in front of us is SB 818, patroned by Senator Spruill. There is a substitute in your docket, and I move the substitute.
You've heard the motion on the substitute? Second. And a second. All in favor of adopting the substitute, please say aye. Aye. Noes have the same right. Ayes have it. Senator Hashmi?
Thank you, Madam Chair. The patron worked closely with multiple stakeholders to make sure that this bill was in the proper form, and it requires that our public schools provide at each grade level, in addition to health instruction, age-appropriate course of instruction on mental health. And certainly, given the crisis that we see, the committee felt that this was a good bill, and it reported on a vote of 5-0, and I so move.
It's been moved and second that the bill be reported with the substitute. All in favor of that motion, please designate electronically.
He's on.
Ayes 15, no zero.
Excuse me. Ayes 15, no zero. The bill will be reported with the substitute. Senator?
Thank you, Madam Chair. Next bill is SB 819, patroned by Senator Favola, and the patron requested that we strike the move, and I so move.
It's been moved and properly second that the bill be stricken at the request of the patron. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be stricken. Senator Hashmi.
The next bill is SB 825, patroned by Senator Bell, and there is a substitute. I move the substitute.
Substitute, and there's been a motion and a second to move the substitute. All in favor of adopting the substitute, please say aye.
Aye.
Ayes have it. Senator Hashmi.
Senator Bell is the chair of the Board of Visitors at our Virginia School for the Deaf and Blind, and he's been working very closely with the Board of Visitors as well as the superintendent and our Secretary of Education. And one of the issues that he identified is the fact that our School for the Deaf and Blind is in a problematic area because it was under DSS, and we have now moved it to under the governor and his authority, and so now we have the opportunity to make sure that the Virginia School for the Deaf and Blind is also subject to the same requirement of all of our school boards as our applicants seek employment, that we have the necessary opportunity to do appropriate background checks. This is a bill that's supported by the Board of Visitors, and we reported as a committee on a vote of 5-0, and I so move.
You've heard the motion and the second that the bill be reported with the substitute. All in favor of that motion, please. And refer to Senate Finance. All in favor of that motion, please. Nothing. She said her mistake.
826.
I shouldn't have said that.
Not fine.
But the bill will be reported with the substitute. All in favor of that motion, please designate electronically. It does not go to finance. Thank you.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute. Senator Hashmi, the next bill will be going to finance.
Okay. The next bill is SB 826, again concerning our Virginia School for the Deaf and Blind. This school is unique. You know, it's almost 200 years old now, but we need to also identify the fact that it is a boarding school. There are children in residence throughout the week. They're from all over the Commonwealth, and this would authorize the governing board of VSDB to establish a campus police department and employ campus police officers to protect the students as well as faculty and staff who live on campus. The committee recommended that we report the bill, and I move that we report and re-refer to finance.
Second.
You've heard the motion and the second that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and re-referred to Senate Finance. Thank you. Senator Hashmi?
Thank you, Madam Chair. SB 832 is identical to the bill that we considered last week from Senator Reeves, and I am sorry, I don't remember the number of the bill, but Senator Chase had requested to pass by the previous week and to be considered again last week, but at her request last week, we have the same motion now that we pass by indefinitely with a letter to the Secretary of Education, as we did with Senator Reeves' bill.
You've heard the motion that the bill be passed by indefinitely with a letter. All in favor of the motion, please designate electronically.
Ayes 14, noes 1.
Ayes 14, noes 1. The bill will be passed by indefinitely with a letter to the Secretary of Education. Senator Hashmi?
Madam Chair, the next bill is SB 876, patroned by Senator McDougal. This bill failed to report on a vote of 2 to 3. This would require that it would prohibit any child from being denied admission to a school for not receiving a COVID-19 vaccination. COVID-19 vaccination is actually not a part of our required immunizations in our public schools right now. But the issue with this particular bill, that it would prohibit our State Board of Health from adopting any regulation requiring immunization for attendance in public elementary or secondary school. It would set a dangerous precedence for making prohibitions and tying the hands of our State Board of Health. For that reason, it failed to report, and I move that we pass by indefinitely.
Second.
You heard the motion and the second that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 8, noes 6, 1 abstention.
Ayes 8, noes 6, 1 abstention. The bill will be passed by indefinitely. Senator Hashmi?
The next bill is SB 911, patroned by Senator Cosgrove. It was incorporated into SB 1186, on which I will be reporting in a few minutes. I move the incorporation.
It's been moved that the bill be incorporated, and I think this is going to require an electronic vote. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bills are incorporated. Senator Hashmi?
The next bill is SB 962, patroned by Senator Peake. This bill considers the issue of our transgender students who are participating in athletic teams and intramural athletic teams within our public schools. The issue, of course, is that we already have regulations and guidelines, policy guidelines established by our VHSL, and this was not considered an issue that we needed to rewrite those policies, which are working effectively for the Commonwealth. This bill was voted to pass by indefinitely, and I so move.
Second.
It's been moved and properly seconded that the bill be passed by indefinitely.
Madam Chairman,
Senator Donovan.
and may I speak to that, please? I would like, I've done a lot of research on this since we saw these bills. And this is definitely something I think that we need to have a process to look at. But I really challenge the process we have, because I've read the guidelines in VSHL, and they basically require letters of recommendation. If you look at competitive sports at the Olympic Committee and even at NCAA, there are scientific analyses that are done to ensure that there is a level playing field, whether it's testosterone levels or age of transition, that, you know, there are two entities here we're trying to protect. And one is, we want to protect young women who have worked their whole lives to achieve great things, and not unlevel the playing field for them in sports. And so neither absolute answer is perfect, but we need to do better in Virginia, because 3 letters of recommendation is not enough to ensure that we are protecting the young women who should have an opportunity to achieve and succeed. So I hope we'll be looking at this more closely over the next year, because we can do better in Virginia.
Madam Chair.
Senator Peterson.
I just want to respond to my colleague, and one of my themes since I've been here is staying out of interscholastic sports. We have an organization, VHSL, which does a pretty good job of balancing competition. And by the way, one day when I want real power, I'm going to ask to be on that board, and I'm going to leave this body. And deal with some real issues. But I think we need to defeat these bills, because I think we need to let VHSL do its own work. And by the way, I've defeated Democratic bills on the exact same basis. So I think we need to leave VHSL to do their own work. Thank you.
There's a motion and a second on the floor that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 9, no 6.
Ayes 9, no 6. The bill will be passed by indefinitely. Senator Hashmi.
Madam Chair, the next bill is SB 964, patroned by Senator Peake, and this was a clarification. It clarifies that any child day program offered by private school accredited by and in good standing in the Commonwealth and operated for no more than 4 hours per day also then provide the licensure exemption program, which is already being provided for programs that are attended by children who are at least 5 years of age. The committee recommended that we report the bill on a vote of 5-0, and I so move.
It's been moved and properly seconded that Senate Bill 964 be reported. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill is reported. Senator Hashmi.
The next bill is SB 1099, patroned by Senator Normand. This would provide that matching grants from our School Resource Officer Incentive Grants Fund may be awarded to local law enforcement agencies and school boards for expenses related to the equipment necessary for uniformed school resource officers or security officers. There was an amendment that was requested by committee. I move the amendment.
Second.
You've heard a motion and a second that the amendment be adopted. All in favor of adopting the amendment, please say aye. Noes have the same right. Ayes have it. Senator Hashmi.
So just to clarify the amendment, the committee asked the patron to clarify what that equipment necessarily is. And so the amendment that you have in front of you is line 28, that such grants shall not be used for any expense related to the purchase of firearms, handcuffs, or other wrist restraints or stun weapon, but can be used for purposes such as training material and any other necessary equipment that's needed for SROs. This bill reported with the amendment on a vote of 4-1, and I so move.
It's been moved and properly second that the bill be reported with the amendment. All in favor of that motion, please designate electronically.
In finance.
I don't have the finance.
And we refer to finance with the amendment. All in favor of that motion, please designate electronically. Thank you.
Okay.
Ayes 14, noes 1.
Ayes 14, noes 1. The bill will be reported and be referred to Senate Finance with the amendment. Senator Hashmi.
The next bill is SB 1109. This is my bill, and this is seeking to help us address the issue of English learners within our public schools. This would establish the College and Career Readiness Program for EL students and support English language learning students as they prepare to go to other career opportunities. This gives grants to our local school divisions so that they can be supported in those endeavors. And so it also directs the board to establish guidelines for the administration of the program as well. This reported out of committee on a vote of 5-0. I move that we report the bill and re-refer to finance.
You've heard the motion and a second that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically. Thank you.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported and re-referred to Senate Finance. Senator Hashmi.
Thank you, Madam Chair. The next bill is 1118, again, my bill, and also, again, trying to address the issues of our English language students. This provides that each school board shall adopt employment policies and practices to help address those needs by providing financial support by teachers who are seeking and obtaining an endorsement in English as a second language in our public schools. This bill is designed to help address the crisis and the shortage that we have in EL instructors and incentivize the program and the opportunity by which we have more teachers who are credentialed to work with our EL population. This bill reported on a vote of 5-0. I move that we report the bill and re-refer to finance.
Second.
There's a motion and a second that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported and re-referred to Senate Finance. Senator Hashmi.
Next bill is SB 1173, patroned by Senator Donovan. This requires that our Board of Education develop guidelines for advanced academic opportunities, requiring that any opportunities that are offered in any public secondary school to accept eligible students. There was considerable discussion around this, most particularly around the issue of capacity and ability to accept any students that are so engaged. There is a substitute, and I move the substitute.
You've heard the motion and the second on the substitute. All in favor of that motion, please designate it by saying aye.
Aye.
Noes have the same right. Ayes have it. Senator Hashmi.
So we had, as I mentioned, considerable discussion, most particularly from a couple of our school divisions, and also from our education organizations, indicating that this would broaden the opportunity for that this would put many of our schools in a difficult position should they be required to accept a broad number of students without necessarily having capacity or having teachers in place to accommodate all the students. I believe the substitute now is moving it into a work group to evaluate this. Am I correct, Senator Donovan?
Thank you, Madam Chairman and Madam
Senator
Chairman.
Donovan.
Thank you. Actually, first of all, I'd like to make a quick amendment to the substitute. It's for delayed enactment. You know, my recall of the conversation in committee is that making sure that every child in Virginia that has the capacity to participate in an advanced academic program that attributes additional grade point average advantage to them as well should have that opportunity. And everybody agreed with the concept, but it was the implementation of process around which there was concern because there were a lot of variables that were involved. And to accomplish a genuine attempt at building out how we do this well and reaching that aspiration, we put together the work group so that everybody would have a say in how that happens. And the amendment that I'm proposing is delaying on line 38. The report would not come out until July of 2024, and the guidelines would not be instituted until the school year of 25-26, Madam Chairman, to give the change that will be necessary for this to happen in a lot of different ways across the state and different school divisions, the ability for that to happen. So with that, I move the amendments in addition to the substitute.
Substitute motion to PBI.
Well, substitute motion takes precedence. All in favor of the substitute motion?
Chairman, I hadn't made a motion on the bill. Just to move the amendments.
Oh, yeah. Withdraw the motion.
Withdraw the motion. There's a motion on the amendment. All in favor of adopting the amendments, please say aye. Aye. Noes have the same right. Ayes have it. Senator Hashmi.
Madam Chair, this reported out of committee, but I was the no vote, and then my colleagues, Senator Howell and Senator Locke, were not present in committee room, and so I proxied abstention on their behalf. I am not comfortable recommending or that we report the bill. Should anyone on the committee want to make that motion?
Madam Chairman, I'll make that motion. Yes, I think this is a bill that the aspiration was agreed upon.
Senator Hashmi, did you conclude your statement?
I did. Thank you, Madam
Okay,
Chair.
Senator
Move to
Donovan?
report.
Second.
It's been moved and properly
Substitute motion PBI.
there is a substitute motion that the bill be passed by indefinitely. Second. And a second. Substitute motion takes precedence. All in favor of that motion, please designate it electronically, yea or nay.
Ayes 8, noes 7.
Ayes 8, noes 7. The bill will be passed by indefinitely. Senator Hashmi.
Madam Chair, SB 1186 is the bill that has incorporated SB 911, which we just took a look at from Senator Cosgrove. This is concerning the same issue of transgender athletes within our public schools. The committee voted for the same reasons to pass by indefinitely, and I so move.
Second.
It's been moved and properly second.
Substitute motion, Madam Chairman,
Senator Cosgrove.
to report.
Did I hear a second?
Second.
It's been moved and properly second that Senate Bill 1186 be reported. All in favor of that motion, please designate electronically. No, I'm trying to vote for Sasslaw because he's out of this chair. Will you suspend? Thank you.
Ayes 4, noes 10.
Ayes 4, noes 10. The bill will be passed by indefinitely. Say again?
Madam Chair, I was just asking if you wanted to.
It's going to be the reverse.
Yeah, I thought that was a substitute motion, so I thought we had to go back to the original
I did, I
motion.
voted you no. Okay. Mr. Chairman, I'm sorry, Mr. Clerk? Okay, back to the original vote. Just want to be clear on where we are. Now, the original vote is to pass by indefinitely, is that correct? Okay, all in favor of that motion, please designate electronically. Senator Sasslaw, you have your, okay.
Ayes 10, noes 5.
Ayes 10, noes 5, the bill will be passed by indefinitely. Uh-oh. This germ is traveling down this. Senator Hashmi.
Thank you, Madam Chair. The next bill is SB 1260, and this is your bill, Madam Chair. And we heard from many individuals during the subcommittee how this opportunity for our teachers to work towards national board certification towards the National Board Certification Incentive Reward Program is a wonderful opportunity for public school teachers. It is the gold standard, and we certainly want to encourage our instructors to work towards this certification. This bill reported on a vote of 5-0, and I so move. And re-refer to finance.
You've heard the motion that the bill be reported and referred to finance, and there's a second. All in favor of that motion, please designate it electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and re-referred to Senate Finance. Senator Hashmi.
SB 1277, patroned by Senator Donovan, has a substitute. I move the substitute.
You've heard the motion and the second that the substitute be adopted. All in favor, please say aye. Aye. Noes have the same right. Senator Hashmi.
This bill, with the amendment, will establish a work group to help our Board of Education to develop guidelines and policies that would permit our high school students in grades 11 and 12 to earn half of a standard unit of credit per semester through employment opportunities in certain fields or industries, encouraging opportunities for students to have work-based learning. And we recommend it for reporting with the substitute, and I so move.
You've heard the motion for the substitute.
Second.
It's been moved and properly seconded that the substitute be adopted. All in favor, please say aye. Aye.
Oh, sorry.
Okay, this is the recommendation to report with the substitute. Yeah, we've already adopted the substitute. This is the motion to report the bill with the substitute. All in favor, please vote electronically. Thank you.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute. Senator Hashmi.
SB 1281, again patroned by Senator Donovan, has a substitute. I move the substitute.
It's been moved and seconded that the substitute be adopted. All in favor of that motion, please say aye.
Aye.
Senator Hashmi.
The substitute again establishes a work group to direct the Board of Education to develop guidelines to be adopted by school boards, directing prioritization of funding be given to dual enrollment courses, including courses that are part of the Passport program or Uniform Certificate of General Studies program. The committee moved to report, and I so move.
It's been moved and properly second that the bill be reported with the substitute. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute. Senator Hashmi.
SB 1325, patroned by Senator McClellan, is a bill that we are familiar with. It received thumbs up by everybody in the room. We want to make sure that we are funding our SOQ Qs at the level that they need to be funded, making sure that we are providing the support and the resources to our school systems and school districts. And so it reported out of committee on a vote of 5-0. I recommend we report, and I move that we report and re-refer to finance.
You've heard a motion and a second that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and re-referred to Senate Finance. Senator Hashmi.
SB 1329 has a substitute. I move the substitute.
It's been moved properly second that the substitute be adopted. All in favor of that motion, please say aye. Aye. Ayes have it. Senator Hashmi.
This bill is patroned by Senators McClellan and Peterson, and it would require the Board of Education to create and maintain the Virginia Parent Data Portal that would display individualized student assessment data, as well as make sure that it is provided in a format that shows current and cumulative data, and do so within a reasonable time period of 45 days. This is a issue and a concern that we have certainly been hearing about, and the committee recommended reporting. I move that we report with the substitute and re-refer to finance.
You've heard the motion and the second that the bill be reported and referred to Senate Finance with the substitute. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and referred to Senate Finance with the substitute. Senator Hashmi.
Madam Chair, the next bill is SB 1334. This is my bill, and there is a substitute that's being handed out now, and I move the substitute.
You've heard the motion and the second on the substitute. All in favor of adopting the substitute, please say aye. Aye. Noes have the same right. Sounds like the ayes have it. Senator Hashmi.
While the bill did report out of committee with a substitute, there was still ongoing conversations with a variety of stakeholders. So we've now reached a consensus on convening a work group through VDOE to ensure that we have full and robust conversation around the development of code of ethics in our individualized education program meetings, our IEP meetings, which, as we all know, are very sensitive and complicated by the various regulations that we have, both federally as well as at the state level, and we need to have opportunities for everyone to understand the process appropriately, to be able to contribute and to advocate for the students and for their education programs. So this new bill now then, or the substitute now that's in front of us, would ask that we convene a work group with a wide distribution of stakeholders and that everyone have the opportunity to engage in this process. I move that we adopt report the substitute.
Madam Chair.
Senator Shuline.
Thank you, Madam Chair. I have a question for the patron. I understand who the school staff, parents, and students are. I don't understand who the other participants with expertise or knowledge of the student might be. Because it seems like everyone else with the school would be covered from the staff, and then we have the parents and students. So I'm just curious to who these folks are, so I can better understand it.
Madam Chair and Senator Suderline, which lines are you referring to?
Senator Suderline.
Yes, Madam Chair. On line 13, it says, and any other participants with expertise or knowledge of the student. And I'm just trying to figure out who that would be.
Senator Hashmi.
Thank you, Madam Chair. So we, in IEP meetings, there are typically many individuals who participate, and some of those are the advocates, parent advocates, child advocates who are familiar with the case of the student and are accompanying the parents to provide their guidance and their information about the IEP process.
Senator Shuline.
Madam Chair, I thank the patron.
Thank you. Senator Hashmi with the recommendation.
I move that we recommend that we report the bill.
It's been moved properly second that the bill be reported with the substitute. All in favor of that motion, designate electronically your preference.
Ayes 9, noes 5, 1 abstention.
Ayes 9, noes 5, 1 abstention. The bill will be reported with the substitute. Senator Hashmi.
SB 1359, patroned by Senator Norman, has an amendment. I move the amendment.
It's been moved and properly seconded that the amendment be agreed to. All in favor of that motion, please say aye.
Aye.
Noes have the same right. Ayes have it. Senator Hashmi.
This particular bill requires each local school board to work with its local law enforcement agencies to conduct an annual threat assessment to determine potential risk and threats for each school within the locality. And this bill was reported with the amendment on a vote of 5-0. I move that we report the bill.
It's been moved and properly second that the bill be reported with the amendment. All in favor of that motion designated electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the amendment. Senator Hashmi.
Madam Chair, SB 1463, patroned by Senator Chase, has a substitute. I move the substitute.
It's been moved and properly second that the substitute be agreed to. All in favor of that motion say aye.
Aye.
Noes have the same right. Ayes have it. Senator Hashmi.
This bill had some issues when it was first presented. It was trying to address the public school libraries, but it also encompassed our public libraries. We worked to try to amend the language in committee, but the issue still remained that it would require our school libraries to put labels on bills on any books that contain sexually explicit content. This is a challenge for our school libraries, as we've heard repeatedly from our school librarians, and the definition of sexually explicit content can be rather wide and varying based on different concerns. This bill was recommended, did not report on a vote of 2-3. I would move that we pass by indefinitely.
You've heard the motion that the bill be passed by indefinitely with the second. All in favor of that motion, please vote electronically.
Ayes 9, no 6.
Ayes 9, no 6. The bill will be passed by indefinitely. Senator Hashmi.
SB 1481, patroned by Senator Donovan, would prohibit school boards from withholding any any pupil or pupil's parent, any information that's transmitted solely to the school board or the school employee or agent. This is adding language to the code around the necessary need to report students' achievement on the PSAT, primarily the letters of commendation, and we heard testimony on this concern. There were issues raised by committee members about the need to include this very, very specific language in code. The bill did fail to report on a vote of 2-3. I recommend that, I move that we pass by indefinitely.
Second.
Madam Chairman.
Senator Donovan.
Thank you, Madam Chairman. I hope there's nobody in this room that would say that they would ever want to see what's happened this year on reporting these commendations to students would ever happen again. And undoubtedly, it's caused potential jeopardy for really accomplished kids who are competing for scholarships and positions at very competitive schools. And the bill does no harm to codify that this is a requirement that it be reported in a timely manner. I think it aligns with all of our expectations and even the expectations and best intentions of all of the schools. And this is not a political issue. It's being politicized now. This is the right thing to do to make sure that there's accountability, and this is a high priority for the schools, so never again does it go by for 3 months and kids lose the opportunity to include it on their applications. You know, mom taught me mistakes happen, but you make sure they don't happen again. And this bill seeks to do this. So I'm going to propose a substitute motion, which is to report the bill.
Senator Peterson.
Yeah, if I want to briefly speak to the motion, first of all, I want to thank, I was contacted by parents because this issue originally arose in my Senate district, and I was contacted by parents. I want to thank them for bringing it forward, but let me make a distinct point. I do believe that there were mistakes made, but mistakes happen. For example, we recently had a mistake made by the Department of Education how they allocated budget spending, and I didn't jump on that and start bashing people. And nor do I bash the Fairfax County Public Schools, because I do think mistakes happen and we learn from mistakes. I think where we try and put it into the code and say, well, you've got to do this, you've got to do that, I think that's where we do politicize it. And I was critical that where the Attorney General, I felt like it was inappropriate to take this and make it something bigger. I want to thank parents for coming forward and expressing their disappointment. They have every right to do that, just like people have every right to express their disappointment for the Department of Education for getting the funding numbers wrong. But again, I just feel like if we put this in the code, then we are making it a political issue where, again, it's a question of competence and getting better, not a question of, again, trying to score political points. And as you probably know, I support Senator Donovan. In fact, I just voted for a couple of her bills just a moment ago. I'm not going to support this one. And again, it's not that I don't respect the parents who reached out to me personally. And I appreciate what they did, but I don't support putting this in the code for the reasons I expressed. Thanks.
Madam Chairman.
Senator Cosgrove.
Thank you, Madam Chairman. I have a little different view of that. Yeah, mistakes happen, but what happened in Northern Virginia was not a mistake. It wasn't done by mistake. It was done with focused purpose. There would be equal outcome for all students, regardless. That was not a mistake. And I think this legislation is necessary to make sure that that type of willful action does not happen to these kids who have worked so very hard to get that recognition and be able to put that on their college applications. Thank you.
Madam Chair.
Senator Hashmi?
Madam Chair, I would disagree that this mistake was done deliberately. It baffles me to think that any school or school division would seek to not highlight its high-achieving students or the accomplishments that those students have made during their academic school year. Quite the reverse. I see our school divisions working really hard to champion their successes because student success is indicative of school success and teacher success. And so I do think firmly that perhaps mistakes were made in letters of commendation. I certainly haven't seen the parents of students who received the finalist or semifinalist levels, which are the two highest levels in this particular case. They have not shared any concerns. And so, again, I would doubt that schools are trying to hide the accomplishments of their students for any political purposes.
Thank you, Senator Hashmi. There's a substitute motion on the floor that was made by Senator Donovan, and that is that the bill be reported. So that the substitute motion takes precedence. So all in favor of that motion, please designate electronically.
Ayes 7, noes 8.
Ayes 7, noes 8. The bill does not report. You want to revert back to the original motion, which is to have the bill passed by indefinitely? All in favor of the motion made by the committee chair, please designate electronically.
Ayes 8, noes 7.
Ayes 8, noes 7. The bill will be passed by indefinitely. Senator Hashmi, it appears that concludes your report for the morning, and I thank you kindly for your hard work.
Thank you, Madam Chair.
Now we will turn to the bills in higher education, and that committee is chaired by Senator Locke. Senator Locke.
Thank you, Madam Chair. I'll begin with Senate Bill 1030, patroned by Senator Normant. This bill requires the governing board of each public institution of higher education to adopt policies and procedures requiring the release of each student or the parent of the student, if the student is a dependent, an itemized list of how the student's individual annual tuition and other mandatory fees are allocated, to include the exact amount of the student's tuition and mandatory fees that are used to subsidize financial aid grants and scholarships for other students. And there is an opt-out provision as well for that itemized list. The subcommittee voted on a vote of 2 yes, 1 no, 2 abstentions to report this Senate Bill 1030. and I move that it be reported. Oh, I'm sorry,
That's why I'm here.
I wondered why you showed up.
Well, actually, I wanted to see you.
Okay.
The amendments are being
So-
distributed.
So there is a substitute that.
There's a
that
substitute.
Senator Norman is here to try to convince us on this.
Okay, then let's first of all, agree to the substitute. All in favor of agreeing to the substitute, please say aye.
Aye.
Noes have the same right. Ayes have it. Senator Locke,
I would ask that Senator Norman address the substitute.
thank you.
Thank you, Madam Chairman. I know you all are crushed today, and thank you for letting me intervene, but the substitute addressed a couple of issues, and it's on page 4, starting at line 103, and it eliminates the requirement of the higher education institutions to itemize what the fees, the other fees may be. It just requires, in the name of transparency, that either the student or the parent who's enrolled, what the dollar amount in tuition and fees that is being used to subsidize, cross-subsidize, if you will, student aid for other students. So it eliminates that provision. It also restricts it to in-state students only. I don't mean to be insensitive, but I do believe that the out-of-state student should pay the full amount of it. I had a number of bills, and this is the only one I wanted to address, and pretty passionate about this. I know that the chairpersons of the Finance Committee have been very passionate about education funding. I put a budget amendment in of $100 million for additional financial assistance. And here's what got my attention, without naming schools. That one particular school, during the course of one year, they're paying $3,500 in addition to their normal tuition that is going to subsidize needy students' tuition and fees. That's $14,000 over a period of 4 years. And candidly, I don't think that that's appropriate, but the real shock of it, Madam Chairman, is nobody knows that that's embedded in their tuition and fees. And even the head of SHEV, when I asked him before the subcommittee, how many people know this, he says, nobody. And so this is a disclosure situation, and it does allow people to opt out on it. I know that Madam Chairman of the Finance Committee has expressed concern about financial assistance, and I agree with her. And I believe one of the things that Madam Chairman said is that believes Virginians should absorb this. What you've got is a situation where these in-state students, parents and stuff, they are already contributing in taxes. So it is part of that 8.5 million contribution that is being made. But in addition to that, they're paying the $3,500 on top of that. And the really egregious situation is that families that are borrowing money to send their kids to school, that they're paying it. And it just didn't seem to be quite forthright to me.
So, Madam Chair, that's the substitute that's been presented to us.
We've already adopted the substitute.
already adopted
We need
the
a
substitute.
need a motion on the bill. It has been moved and properly seconded that the bill be reported with the substitute.
Does it need to go to finance?
And the Chair of Senate Finance and Appropriations said the bill probably needs to go to finance, so that motion will be to report and re-refer to Senate Finance with a substitute.
Madam Chair,
All in favor of that motion?
I have a question. for the
Senator
patron.
Edwards has a question.
I can barely hear him. Please speak
I have
into your
a
mic.
question of the patron.
Senator Edwards.
So are you going to have additional monies for financial aid in lieu of this?
Madam Chairman,
Senator
I would say
Norman.
I have two issues that parents and students are paying this and they don't know it, number one. Number two, in one university, it is $14,000 over 4 years. And that is an increased cost in education. And I put in addition to.
Can we give our attention to Senator Norman?
in addition to what the governor put in and what the Senate Finance Committee may do, I put a budget amendment in for $100 million in additional financial aid.
Senator Edwards, does that
Yeah,
conclude?
that's fine.
Madam Chair,
Senator Peterson?
and I apologize, I'm on this subcommittee, but I'm on so many, I wasn't at this hearing. Is it possible to get a precise definition of, obviously, we've got scholarship money we give through the state budget, but your contention is, and I defer to you, that a portion of the tuition I pay on behalf of my kids is being used to subsidize, in other words,
Yes, sir.
To subsidize.
there's a subsidization going on within outside of what's going on with the scholarship money we award or the
Yes,
grants
sir.
we award through the state budget.
Yes, Madam Chairman, yes,
Thank
sir.
you.
Yeah,
Mr.
I have another question.
I mean, if you, Madam Chairman, you're a much better wordsmith than I am. If you want to tinker with that definition, I'm happy to do it. I don't think that changes the objective that I have.
Madam Chair,
Senator Edwards?
isn't it true that every school in the country does this? Harvard, for example, has 90% of the people get scholarships, but their fathers who are making $1 million, they pay a whole lot more. It covers everything, other people. Don't they always do this?
Madam Chairman, I
Senator
would say
Norman.
I don't know about other schools, and I never thought about Harvard. It was all I could do to get in undergraduate school. There are 2 schools in the Commonwealth of Virginia that do not do this now, And I can tell you that the fees that are being charged range from $38 a year, which is de minimis, to $3,522. I mean, the reality of it is, very candidly, is that the Commonwealth of Virginia needs to step up and make the contribution, and that's why I put the $100 million in. I
see.
just don't think it's appropriate.
Thank you, Senator Norman, for that clarification. Senator Locke, I'm back to you for a motion.
What, we made.
Oh, the motion is
based
already
upon-
made. Okay, the motion is to report and re-refer to Senate Finance with the substitute. And I think any further clarification that might be required of any member who is on Senate Finance will be able to get
I'll work
those.
with staff to try to
Thank you.
get that definition better.
So you heard the motion and the second to report and re-refer with a substitute to Senate Finance and Appropriations. All in favor of that motion, please designate electronically. Thank you.
Ayes 12, noes 3.
Thank you.
Ayes 12, noes 3. The bill will be reported and re-referred to Senate
Thank
Finance
you,
with the
Madam
substitute.
Chairman, and I tell Chairman of Finance I will work on that definition. But this is only 4-year institutions too, I should have said. Thank you all for your courtesy.
Thank you so much. Senator Locke, back to you for your subcommittee report.
Okay, Madam Chair, we have Senate Bill 1098, also patroned by Senator Norment. And this bill would prohibit any public institution of higher education from implementing new programs of instruction or new curriculum for any existing program of instruction by inserting the General Assembly into approval process for such programs. And on a vote of 4-1, it was recommended that this bill be passed by indefinitely, and I move that Senate Bill 1098 be passed by indefinitely.
You've heard the motion? And the second that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 10, noes 4, 1 abstention.
Ayes 10, noes 4, 1 abstention. The bill will be passed by indefinitely. Senator Locke?
Senate Bill 1110 is Senator Hashmi's bill, and she has a substitute for this bill, which she will explain.
May I get a motion on the substitute?
Move the substitute.
It's been moved and properly second that the substitute be agreed to. All in favor of that motion, please say aye.
Aye.
Noes have the same right. Ayes have it. Senator Locke.
I will have ask Senator Hashmi to explain her substitute.
Senator Hashmi.
Thank you, Madam Chair. This bill, again, we sought to address the concern last year. It did pass out of the Senate on the issue of transcript withholding. We've been working with stakeholders, our institutions of higher learning, as well as advocates for our student population. This bill is more narrowly defined this year, and the substitute in front of you indicates that the academic transcript would be released for two reasons. One, if the student is applying for employment or pursuing opportunities in armed forces or with the National Guard, and that those transcripts would go directly to the employer, prospective employer, or the recruitment office. And then another provision here is that if a student owes a debt of $500 or less, that the transcript would be released to the student, or if the student has enrolled in a repayment plan and has made at least 3 consecutive monthly payments. I believe there's peace in the valley. I don't like that term, but I believe there's peace in the valley on all of these issues, and so that is the bill that's in front of us.
And with that explanation, Madam Chair, I move the adoption or the passage of Senate Bill 1110.
It has been moved and properly second that the bill be reported with the substitute. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute. Senator Locke.
Next, we have Senate Bill 1172, and there is a substitute, and I move the substitute.
There's a motion on the substitute and a second. All in favor of adopting the substitute, please say aye.
Aye.
Noes have the same right. Ayes have it. Senator Locke.
And the substitute basically is dealing with establishing a standardized, universally accepted curriculum for nursing programs, and it also asks for the convening of a work group to be called the Passport Nursing Program. I think I got all of that right.
Yes, ma'am. Madam Chairman.
Senator Donovan.
I apologize, but one amendment to the substitute, and that is on line 12. And we would strike establish, and instead the line would say shall standardize a core curriculum for all RN degrees. The reason for that small language change is that some work has been done to standardize across some markets, and we're not asking for Chev to recreate a whole new ball of wax, but to work with the momentum that's already moving forward. So I wanted to remove the word establish.
You've heard the explanation for the removal of the one word in the substitute. So all in favor of agreeing to the amendment to the substitute, please say aye.
Aye.
Ayes have it. Senator Locke.
Okay. So with that amendment, we now have Senate Bill 1172, substitute, and an amendment. I move that we report SB 1172.
It has been moved and properly seconded that the substitute, that the bill be reported with the substitute as amended. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute as amended. Senator Locke.
SB 1280, also patroned by Senator Donovan, has a substitute, and I move the substitute.
You've heard the motion on the substitute and the second. All in favor of adopting the substitute, please say aye.
Aye.
Noes have the same right. Ayes have it. Senator Locke.
SB 1280 addresses course credit earned through internships, and this particular bill requires governing boards of each public institution of higher education to develop policies requiring 3 of the total credit hours toward the completion of a bachelor's degree to be earned through participation in an internship or work-based learning experience that would be integrated into the student's degree program, but it does not extend the time for degree completion. It also asks Chev to convene a work group for the purpose of making recommendations on the development and implementation of the policies that will be required to pursue this particular piece of legislation. And with that explanation, Madam Chair, I move that SB 1280 as a substitute be reported.
It has been moved and properly second that Senate Bill 1280 be reported with the substitute. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute. Senator Locke.
SB 1286, patroned by Senator Donovan, has a substitute, and I move the substitute.
You've heard the motion and the second that the substitute be agreed to. All in favor of that motion, please say aye.
Aye.
Noes have the same right. Ayes have it. Senator Locke.
And this substitute deals with the standardization of healthcare-related programs. And specifically, it calls for the development and implementation of a plan to standardize across all comprehensive community colleges the courses offered for healthcare-related degree, credential, or licensure programs, excluding any registered nursing programs. And I think that that's essentially what this does. Okay, and with that explanation, Madam Chair, I move that SB 1286 be reported as a substitute.
You've heard the motion and the second that Senate Bill 1286 be reported as substitute. All in favor of that motion, please designate electronically. Senator says, oh, I didn't realize you were giving me your vote again.
Ayes 15, no zero.
Ayes 15, noes again. The bill will be reported with the substitute. Senator Locke.
Senate Bill 1295, patroned by Senator DeSteph, directs the governing board of each public institution of higher education to adopt policies or guidelines for soliciting industry input in the institution's program review processes and curriculum development at the department level, and to develop procedures for incorporating the attainment of industry credentials and into the institution's existing degree programs to increase degree relevancy and ensure a more seamless pathway from higher education to the workforce. And this SB 1295 on a motion of 2 to 3 failed to report. And so therefore, I move that the bill be passed by indefinitely.
You heard the motion? Second. And a second that Senate Bill 1295 be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 9, no 6.
Ayes 9, no 6. The bill will be passed by indefinitely. And I think now we can clear out the queue. There are no more users in the queue. Okay, Senator Locke.
Senate Bill 1358, patroned by Senator Normant, directs the governing board of each public institution of higher education to adopt policies providing that the percentage of students enrolled at these institutions be capped at a 2% increase over the biennium. And on a vote of 3 to 2 from the subcommittee, the recommendation is that this be passed by indefinitely, and I move that Senate Bill 1358 be passed by indefinitely.
You've heard the motion? And a second that the bill be passed by indefinitely. All in favor of passing by indefinitely, Senate Bill 1358, please designate electronically.
Ayes 12, noes 2, 1 abstention.
Ayes 12, noes 2, 1 abstention. The bill will be passed by indefinitely. Senator Locke.
Senate Bill 1410, at the request of the patron, Senator Hashmi, I move that we strike the bill.
It has been moved and properly second that Senate Bill 1410 be stricken from the docket. All in favor of the request by the patron, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill is stricken at the request of the patron. Senator Locke.
Darn, I thought I was getting close to the end. Okay. Senate Bill 1434 from Senator Suderline declares that it would be the policy of the Commonwealth that any foundation, investment, management company, or other asset manager associated with the public institution of higher education that manages endowment funds with, let me make sure, endowment funds of the public institution of higher education with a value exceeding $250 million will be required to allocate at least 15% of that investment fund back to the public institution of higher education on an annual basis for the purpose of ensuring access to and affordability of attending the institution for students. On a vote of 5-0, it was recommended by the subcommittee that this bill be passed by indefinitely, and I move that SB 1434 be passed by indefinitely.
You heard the motion? And a second, that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 10, noes 5.
Ayes 10, noes 5. The bill will be passed by indefinitely. Senator Locke.
At the request of the patrons, Senate Bill 1444, Senator Hackworth's bill, he asked that that be stricken, and I move that the bill be stricken from the docket.
You've heard the motion and the second that the bill be stricken. All in favor of that motion, please designate electronically.
Ayes 15, noes 0.
Ayes 15, no 0. The bill will be stricken from the docket at the request of the patron. Senator Locke.
Senate Bill 1448, it comes from Senator Lucas, and this bill deals with the reduced rate tuition charge for Virginia students, specifically students at Norfolk State University and Virginia State University. There is a substitute, and I move the substitute.
It has been moved and properly seconded that substitute be adopted. All in favor of that motion, please say aye. Ayes, noes have the same right. Ayes have it. Senator Locke.
Okay, and specifically, Senate Bill 1448 would permit the Norfolk State University Board of Visitors and the Virginia State University Board of Visitors to charge a reduced rate tuition to any non-Virginia student who is enrolled in a program at the relevant institutions that would lead to employment in a high-demand field, to be determined by the board. And with that explanation, I would move that the substitute for Senate Bill 1448 be reported.
Okay, second.
You've heard the motion and the second. Senator Cosgrove.
Thank you, Madam Chairman. This is a good bill. This is it's enabling legislation and it is permissive. It doesn't tell the boards they have to do this. It doesn't tell them what fields are required. It just gives this authority to the Board of Visitors of these two institutions. So that's why I support the bill.
Thank you, Senator Cosgrove. I appreciate that very much. You've heard the motion and the second that the bill will be reported and re-referred with a substitute to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported and be referred to Senate Finance with a substitute. Senator Locke.
Okay, next we have Senate Bill 1461, patroned by Senator Servell, and there's going to be a similar bill coming up shortly. This one deals with the Virginia College Savings Plan, and it would establish a Virginia College Opportunity and Endowment Fund. And this bill would have directed the board of the Virginia College Savings Plan to deposit $250 million per year of surplus money from the plan into what would become the Virginia College Opportunity Fund. And this would have been excess money from Virginia 529. And after a lengthy discussion, the subcommittee voted on a vote of 4-1 to pass by indefinitely Senate Bill 1461. And I move that the bill be passed by indefinitely.
You heard the motion and a second that the bill be passed by indefinitely.
Madam Chair.
Senator Hasmi.
I was one of the ones who voted to pass by indefinitely, but I've had subsequent conversations with the patron who would like the opportunity to work with Senator Barker. We've got these two bills, and I would respectfully ask the chair if we could hear from the patron.
I keep that with me all the time. Senator Hasmi, could you please repeat that?
I would ask that we allow the patron to speak to his efforts to reconcile his bill with Senator Barker's bill.
Well, I hesitate to go down that path since we've already set the parameters. And so I think we're gonna stick with the original intent of the committee for today.
Or we could send them both to finance.
And what we can do is, we could send them both to Senate Finance.
Madam Chairman, yes.
Senator Cosgrove?
I offered this in sub, and I don't know if Senator Servo has changed his mind. Would you rather have yours rolled into Senator Barker's, or do you still want to just leave it as it is?
No, I don't, we talked about that in committee, and I didn't want to be rolled, but.
I didn't know if you changed.
Yeah,
your
but,
mind.
I mean, Barker and I talked about both going to finance and getting merged over there once this policy got vetted by the money committee, but, I had an amendment I gave to Senator Hashmi, which changes mine, and Senator Barker, there's an amendment on his too that I think she might offer at some point as well, but, after the committee discussion, you know, we've been talking about the bill and trying to figure out a way to put them together and reconcile them.
Senator Locke, your motion would be?
I was the no vote, so,
There's a substitute motion on the floor, and that's that the bill be passed by indefinitely.
that was my motion.
That was your
anyway.
motion, and that is the motion. Then he seconded that motion. That's the only motion on the floor. Senator Servo, I'm sorry, but the recommendation is that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 10, noes 3, 1 abstention.
Ayes 10, noes 3, 1 abstention. The bill will be passed by indefinitely. Senator Locke.
Senate Bill 1499 from Senator McClellan provides that the Chief Executive Officer of the VCU Health System Authority may be the individual who holds the role of Vice President for Health Service of VCU, such other title as subsequently established by the university's Board of Visitors, for the Chief Academic and Administrative Officer for the Health Sciences School of the university. Current law requires the Chief Executive Officer to hold such title, so it's simply addressing the title for the individual. And on a vote of 5-0 from the subcommittee, we suggest that this be reported, so I move that Senate Bill 1499 be reported.
You've heard the motion? And
Is this
second?
going to- See, I don't have any of that. Okay, and we refer to finance.
You've heard the motion and the second that the bill be reported and re-referred to Senate Finance. That is Senate Bill 1499. All in favor of that motion, please designate electronically.
Ayes 14, no 0.
Ayes 14, no 0. The bill will be reported and re-referred to Senate Finance. Senator Locke.
Okay, Senate Bill 1519 from Senator Barker is dealing with the same issue as the previously heard bill from Senator Servo. It renames the Virginia College Savings Plan as the Commonwealth Savers Plan, dealing with 529 funds, and it expands the definition of current obligations of the plan, as well as provides that the purpose of the plan is to enhance the accessibility, affordability, and attainability of higher education in the Commonwealth. And on a vote of 3-2, it was recommended that the bill be reported, and I move that Senate Bill 1519 be reported and be referred to Senate Finance.
It's been moved and properly seconded that Senate Bill 1519 be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically. Senator Locke.
I meant no.
She meant what she said.
Ayes 12, noes 2, 1 abstention.
Ayes 12, noes 2, 1 abstention. The bill will be reported and re-referred to Senate Finance. Senator Locke.
Senate Bill 1530, patroned by Senator Donovan, requires the Department of Education, the State Board for Community Colleges, and the State Council of Higher Education to develop a plan to establish and implement what is being called the Standardized Uniform and Comprehensive Collaborative Exchange Schools Support Program Success for the purpose of improving the collaboration between comprehensive community colleges and high schools in the Commonwealth and increasing access for high school students to opportunities for earning post-secondary credits toward completion of an associate's degree or credential. After discussion, it was recommended on a vote of 3-2 that Senate Bill 1350 be passed by indefinitely, and I move that Senate Bill 1530 be passed by indefinitely.
You've heard the motion and the second that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Ayes 9, no 6.
Ayes 9, no 6. The bill will be passed by indefinitely. And Senator Locke,
I believe that completes my.
and that completes your docket, and I appreciate the very hard work that you did. And before we rise from this committee, I'd like for Senator Peterson to make a recognition.
Yep, Madam Chair, I had a constituent that came down today, and I hope she's in the room, and that's Shauna Yasser. And I recognize that we're not taking testimony because the testimony was taken in subcommittees. I had told her she would have a chance to be heard, and that's on me. I want to apologize to her. But she did come down here. She was a parent that was involved, and I just want to, again, appreciate her. And again, I recognize that the chair does not want to take testimony, but she did come down today. She is my constituent, and I would like to thank her and recognize her, and obviously she can be available to speak to us. But that's on me. And
Thank you
I
for coming.
publicly apologize to her for giving her the wrong
I
impression.
thank you for coming, and we really appreciate your efforts to get here to speak to the bill. But once I set the parameters for the committee, just like I did with Senator Servo, I didn't want to break with the pattern and showing a favoritism. So thank you for coming. I'm sorry you could not be heard today. And so with that, I said that Senator Newman?
I mean, I think the committee just did a great work. Thank you for everything you did. This was a lot of bills for a short session and the staff, but thank you, Madam Chair, for everything you did thus far.
Thank you, Senator Newman. I learned it from you. So with the 81 bills that we concluded for today, the committee will rise and get ready for the committee.